Good afternoon, everyone. Thank you for joining us for this discussion. My name is Sarah Holmes. I am Senator Shaheen's State Director here in New Hampshire. We're so pleased to be joined by all of you for this very important discussion. Just a couple of housekeeping items. I know we have representatives from a couple representatives from several organizations. I know you all were going to keep that to one person speaking on behalf of each organization. Obviously, we did have a lot of interest in this topic, so just ask folks to try and keep your remarks to 2 to 3 minutes, and we'll come back around as we have an opportunity at the end of the discussion, but we do want to make sure we're able to hear from everyone. And just housekeeping, I'm sure we're all used to this, just a reminder to keep yourself on mute, and don't forget to unmute yourself when we call on you. I'm just going to run through the names of everyone who's on today, including we do have some representatives from the press. I'll tell you which organizations we have there, and then I'm going to turn it over to Senator Shaheen. So quickly, we have Ken Norton from NAMI.
Hello, good morning. Good afternoon. Good to be here and good to see everybody. Thank you for holding this, Senator, and hi, Sarah.
Thank you, Ken.
Thank you.
And Heather Ziliak. Hi, Heather.
Hello, thank you for having us.
Great. Shamira Simpson, American Foundation for Suicide Prevention.
Hi, thank you so much for having us today. And Heather will be speaking on behalf of our foundation today.
Great. We also have Stacy Santon, who's the board chair for the American Foundation of Suicide Prevention. And we have Steve Annan from the New Hampshire Hospital Association. Hi, Steve.
Good afternoon. Thanks so much for having us. Good to see you.
Thank you. And joining Steve, also from the Hospital Association, we have Kathy Bizarro-Thunberg.
Good afternoon.
Hello, Kathy. And we have Heather Moquin, who's from the Chief Executive Officer of New Hampshire Hospital.
Hi, good afternoon, everyone.
Good afternoon. We have Erica Ungarelli from Children's Behavioral Health at New Hampshire Hospital.
With the Department of Health and Human Services. Good afternoon. Thank you.
Annette from New Hampshire North Country Health Consortium. Hi, Annette. See you down there. Great. We have Jody Labarsky from, she's the Director of Child, Adolescent, and Family Services from the Seacoast Mental Health Center.
Good afternoon. Thank you so much for having me.
Great, thanks. And we have Maureen O'Day, New Hampshire School Counselors Association. She's counselor at Derry.
Thank you very much for including us, as well as the directors of school counseling. Thank you.
Thank you. And we have Chief Chris Purley from Jackson Police Department.
Hi, thank you. Good afternoon, everyone.
Hello. And we have Dr. Julie Walter, who's the chair of the New Hampshire Psychological Association and a psychologist with the Educational Foundation in Nashua.
Good afternoon. Thank you for having us, and good to see everyone. And Chris White from Endurance Behavioral Health will be speaking for NHPA.
Wonderful, and good entree. Chris White, you're next on my list.
Hi, thanks everybody, and thanks for having this. I apologize, I don't know how to change the name on here. It's set up through my work, so
I can responsibility. Change it. I can change it, Chris.
Don't worry.
Yep, I'll fix it when we're done here. Gina Still, the Director of Child and Adolescent Programs from the Mental Health Center of Greater Manchester.
Hello, everybody. Thank you for having us.
Great. And Rick Cornell, also from the Mental Health Center of Greater Manchester, the VP of Communications.
Thank you very much, Senator. Thank you for all the work you do to help us every single day keep going.
Thank you. Dr. John Hink, President-elect of the New Hampshire Psychiatric Society.
Thank you for having me.
Great. Dr. Len Korn, who's a psychiatrist at Portsmouth Hospital and representing the New Hampshire Psychiatric Society. Great. And Dr. Lisa DeBrigida, member of the New Hampshire chapter of the American Academy of Pediatrics and a pediatrician at Amoskeag Health.
Hi, everybody. Very, very excited for the opportunity. And I also don't know how to change my name, so thank you for that.
I'll fix it. Don't worry. Don't worry. Great. Did I miss anyone? Nope. Okay, just to run through the press, we do have on the line representatives from the Union Leader, WMUR, Concord Monitor, and the Caledonian Record. Great. And with that, I'm going to turn it over to Senator Shaheen for some opening remarks.
Well, thanks very much, Sarah. And we're still doing introductions because I want to make sure that you know some of our staff who are on. You know Sarah, Peter Clark, they're telling Peter is not on. Peter Fies is on, who is working on healthcare issues in DC. Andrew Crothers from Washington, and Chris Scott, who many of you may know from who's in the New Hampshire office. So between us, we want to make sure we understand and take notes on everything that's said and make sure that you all know who you can contact in our office in order to help you with any particular issues. I recognize from my days as governor that even before the pandemic, New Hampshire's statistics around mental health and particularly adolescent mental health have been worse than the national average. And the pandemic, we don't have the specific data to confirm this, but based on everything I'm hearing from people, and I'm anxious to hear what all of you have to say, the pandemic has made things worse. We've tried to provide some help in the packages of COVID relief that have passed in Congress, funding in the CARES Act back a year ago, and then we provided additional funding in December and funding in the American Rescue Plan. But I recognize that there are several challenges, even with resources. One is we don't have the practitioners, as or at least that's my understanding, that we really need in order to address this issue. And as we determine what the impact of the pandemic is, that could be worse than it is now in terms of having the people we need who can help provide treatment. And we know that this is going to take some time. And so one of the things I'm interested in hearing from all of you is what more you think we should be doing in Washington. Give me some sense of what's happening in New Hampshire. Obviously, I've read news reports. I understand the problem with emergency room and the lack of inpatient psychiatric beds, particularly for young people. But if you can also just share with us what you're hearing and any thoughts you have about what we should be thinking about in Washington in order to address the concerns that you have. So we have a lot of people, and I know we have a limited time, so I'm going to stop there. Again, thank you all for joining us, and turn it over back to Sarah to call on folks and help moderate our discussion. Thank you.
Great, thank you, Senator. And just a reminder, if folks can try to keep their remarks to 2 to 3 minutes so that we can hear from everyone, that would be appreciated. We're going to start with Ken Norton from NAMI, New Hampshire.
Thank you very much. And Senator, it's good to be here. Obviously, you mentioned emergency department boarding, and that is the most visible symptom that we have relative to the impact of the pandemic, specifically on children. And we've seen those. I mean, I guess a couple things that I would say is that while we're here to talk about youth, and also want to mention young adults, because some of the national data is showing that while we've seen increased stress, anxiety, and depression across all ages, that it's impacting on youth and young adults the most. So the numbers of people that we've seen in young people we've seen, and in New Hampshire, statistic-wise, that's under 18 showing up in our emergency departments, has risen steadily since the pandemic. And during the last quarter, or the first quarter of this year, that was averaging 16 kids on any given day. High number of 51 on Valentine's Day, and the average wait, according to the Foundation for Health, is about 5 days for each kid. So that's, huge impact, very impacting on families as well as practitioners in terms of knowing that people aren't getting the care and the time that they need it. And, you certainly mentioned workforce shortages. That's a big part of that. Affordable housing is a big part in a number of ways, whether that's for people in terms of having housing instability or attracting workforce, whatever. When we look at homelessness, and that's been a big issue for young adults as well, a lot of the young adult population are in some of our homeless camps, and they're folks that tend to have high rates of mental health issues and co-occurring substance use disorder. And then we don't really know what the long-term impacts are going to be. And that's, I think, one of the significant questions, particularly when we're looking at youth that, you know, was as adults, we may, although we've never experienced anything like this in our lifetime, we've had our ups and downs, we've had troubles. But for kids that may have missed significant academic achievements or milestones during the past year, social and developmental, this could have long-term and far-ranging impacts on their mental health. While we did see a decrease in suicide deaths during 2020, there's a lot of debate, and Shamara will probably cover this, but in the suicide prevention community about how we interpreted that. So just circling back to the ED boarding piece, that, you know, that the good news is that particularly for young people, they are coming and getting and asking for help. And then the last piece that I would just mention is two things. Great 988 is a wonderful piece of legislation, offers a lot of opportunities for us in the future, and we need to continue to work on parity with commercial insurers, and that's a big part of things as well. Thanks.
Thanks, Ken. One of the other things I should have pointed out earlier is, and I'm sure you all know this, but of the $350 million that's coming to New Hampshire alone for schools, it includes flexibility in those funds to be able to help with mental health issues, to hire counselors. And so hopefully that can also provide help as we're thinking about how we cover young people. I was in Salem earlier today meeting with the school officials there, and they've actually had people in session the whole year. They've not gone remotely for their entire school student body. And they were talking about some of the ways in which they're trying to address mental health issues in young people. One of the things they talked about that I had not heard of other school districts doing is Wellness Wednesday, where every Wednesday, all students across the district answer a questionnaire that they then hand in to whoever the assigned adult is, where they answer questions about how they're doing, which I thought was a creative way for school districts to try and get more information from kids about how they're feeling and what their mental health situation is. So thank you. That's a long response, but thank you, Ken, for everything you're doing.
Thanks.
Next, American Foundation for Suicide Prevention.
Thank you. Thank you, Sarah. Thank you, Senator Shaheen. My name is Heather Zilak. I am from Concord, New Hampshire. I am representing the American Foundation for Suicide Prevention and the New Hampshire chapter. We're dedicated to saving lives and bringing hope to those affected by suicide. AFSP creates a culture that's smart about mental health through education and community programs. We develop suicide prevention through research and advocacy, and we provide support for those affected by suicide. Our work continues to be about connection with people where they are. We've had good luck connecting in spite of the physical distance restrictions. For people with access to Zoom, we've worked really hard to bring awareness, education, and hope. With evidence-informed programming and language, along with our collaborating partners, we're creating a community of people who are engaged and invested in their mental health and loved ones' mental health. Some statistics that we have for New Hampshire: suicide is the 8th leading cause of death in New Hampshire. It's the 2nd leading cause of death for ages 10 through 34. Our state fact sheet will be attached. The 2019 National Youth Risk Behavior Survey reported 18.8% of students report having seriously considered suicide. According to the new provisional data from the CDC, deaths by suicide declined 5.6% between 2019 and 2020. Suicide has reportedly decreased from the 10th to the 11th leading cause of death as COVID-19 became the 3rd leading cause of death. Although the CDC has not reported state-specific numbers, I think we can agree that this potential trend is encouraging. The 2019 National Youth Risk Behavior Survey reported that 18.8% of students report having seriously considered suicide. So some of the things that we're looking to do. So school is really an essential touch point that children and teens are interacting with daily in order to help prevent suicide. So a couple of things that we're looking at with AFSP New Hampshire is the increase to increase the amount of mental health professionals in schools, increase training for students, teachers, and school personnel in suicide prevention, implement school policies and protocols on suicide prevention, intervention, and postvention, as well as educate students about mental health and suicide to be empowered to know when and how to ask for help. AFSP has seen an increase in requests for suicide prevention education programming, including conversations around supporting one's mental health during the pandemic. In addition, increase access to care by enforcing mental health parity and expand mental health workforce to help to address barriers as well. And of course, the 988 number is super important, and we're really excited about that too. Thank you.
Thanks. Heather, can you point to any particular programs and any schools around the state that you think have been really effective, that are models that we should look at?
We had recently done, I was part of the education on this. We were working on our More Than Sad program and getting that over to the Merrimack School District. And actually we presented that in February and early March. And we're able to get the entire staff trained from kindergarten to, I think, high school, Sham, if I'm correct, with that group. And I mean, I think it was very well received. Everyone really appreciated it. I think we got a lot out of it. And then we've also started a program called Gizmo, which is geared more towards younger children. So kindergarten through 5th and 6th grade. And that's been really helpful as well, kind of putting together some ideas about our young people and things that they might struggle with when they're angry, frustrated, or sad, and letting them know that it's okay to talk about those things. So it's been really helpful with this program too, to kind of get people talking about those sort of things. And as a mom of an 8-year-old, it's been really helpful to have some of these things in my toolbox.
Thank you.
Thanks.
Great, thank you. Next, we have New Hampshire Hospital Association.
Great, thank you so much. And I really appreciate the opportunity and the spotlight that you're providing here for this issue. You know, we've certainly seen a significant increase in the number of kids in mental health crisis over the last several months, as Ken noted. You know, the good news is they're coming forward and looking for help, and that's important. We just need to make certain that we have the resources to be able to provide that help. It's, you know, not an issue of we just need more inpatient capacity, or we just need more, you know, transitional housing or step down services. We need more capacity across the entire continuum of care, so that people can get care out in the community before the crisis occurs. But it's a continuum, and there will always be patients, some who are on the front end of the continuum, some who are in crisis, and some who are on, you know, coming, you know, out of crisis. And so we need to make certain that we have all of the resources to provide care for patients when and where they need it. You know, there's a lot going on, and I'm sure others can talk about a lot of those things. I guess, you know, a couple of things, you know, from a federal perspective that would be really helpful, and the additional resources from the COVID relief measures, I think, will be important. But, you know, as we think about workforce continues to be one of the greatest challenges. To the extent that Medicare and Medicaid could, you know, provide additional reimbursement for those services would be really, really important. You know, if we can't create those programs and have them be sustainable, it really will be a challenge. And I'll just ask for one other note is, as we think about Medicare, thinking about Medicare Advantage and making certain that, you know, Medicare Advantage plans are held at the same level of accountability as the traditional, you know, Medicare program, so that we don't seem to have patients who sort of are you know, somehow outside of the system. So again, I think that's an important piece to include. You know, whenever we have, you know, people waiting in emergency rooms to get the care that they need, you know, one is too many. You know, the wait list has grown, and there's a lot that's gone into reducing that. I'm sure Heather will talk about the addition of beds at New Hampshire Hospital for Children. That's certainly been a big help to bring that waitlist number down, but it's had a corresponding increase on the adult side. So again, lots of work going on, and I appreciate all of that, and look forward to the conversation. Thank you.
Well, thanks very much, Steve. And on the workforce issue, this is an issue, as all of you know, not just in the mental health area, but in a whole range of areas. And I'm hopeful that if we can do an infrastructure bill, that there will be some piece of that that addresses workforce issues in a variety of ways. And I know there's legislation that we've been talking to folks about that would help pay for school counselors if they spend so many years in the classroom or in the school. So I hope we can get some of these things done.
Thank you.
Great, thank you. I did miss one person on introduction, so I apologize. Katrina Watson is here with us from the New Hampshire Medical Society. So thanks for putting that in the chat, Katrina, I appreciate it. Next up, we have New Hampshire Hospital.
Hi, everybody, and thank you for the opportunity to be able to talk today and listen to everyone as well. I'll keep my comments brief because I'm hoping that Erica Ungarelli will have a few minutes to speak as well and talk specifically about children and child services in areas that she's trying to develop in the department. But as Steve mentioned, we did add 10 child beds recently back to New Hampshire Hospital. And that really was directly related to just the incredible increase in the need of referrals for children. So adults, although the demand has been high, it has been steady throughout the COVID pandemic. Children, though, really, we've seen unprecedented numbers of referrals to emergency departments of kids and families in crisis. So that is one thing that we've done to try to, really just be flexible and adjust to the need of kids in New Hampshire. But I would like to add, I'm really so grateful to hear about this idea or this plan to invest some COVID relief in the schools, because from what we're seeing with kids that are being referred, it really seems to be a direct correlation to the isolation. And we're just seeing more and more how important that school community is for kids across the state. And so anything we can do to support the schools, I think will, in the long range will help. Certainly the 10 beds, it's a short sighted, addition of beds, but what we really need to look at is the support of the schools and the community. The other thing I would like to just add on to is workforce development in New Hampshire. Anything that you can do at a federal level to support that, because certainly we are seeing a real issue in New Hampshire with our nurse workforce, and in particular at New Hampshire Hospital, I'm working hard to add capacity, but my biggest challenge is nurses. And I think that is across the board in nursing homes, hospitals, and in mental health. And I think that this is really, over the next 3 to 5 years, going to be a critical issue. And not just nurses, I am a nurse. So, I can see that our workforce is aging and we're struggling. We need to attract new nurses, but we also need to put some investment in clinicians and social workers. But workforce is a huge issue for us at New Hampshire Hospital.
Yeah, thanks very much, Heather. I certainly have heard that before and hope that we can make some progress in providing assistance, and also thinking about ways we can incentivize people to go into healthcare fields like nursing and social work and mental health counseling.
Thank you.
Good. I don't know, did Erica want to chip in quickly if you had anything else to add?
Sure, I'll be pretty brief. So I'm the director of Children's Behavioral Health at the Department of Health and Human Services. We're doing a lot of systems transformation work. 5 years ago, our bureau did not exist. So as Senator Shaheen has said, that we haven't really attended to children's behavioral health. So we're not enhancing a system, we're really building the system from scratch. And the 10-year mental health plan is really sort of our source document for what we are doing. It includes transformation such as increasing the community-based options for kids. One of the large projects is statewide mobile crisis for kids, which we're nearing completion and implementation, we hope. So all of that expansion and transformation work, what worries us again is the workforce issue. Across all of the community mental health centers, they have over 200 vacancies. And if we're asking them to do more things or different things, we're worried about the staffing, that whether or not they'll be able to implement that. And now we're seeing some impacts to our another portion of the system, the residential treatment, who's having similar issues with recruiting and retaining staff and their staffing capacity, which is causing delays for kids being discharged from the hospital to go onto another level of treatment that they may need. We are also partnering with the Department of Education to improve and expand our behavioral health work in schools. So that's great. We are utilizing a federal system of care grant for that work. Again, sustainability and rates and all of those things that have been said thus far, to sustain that sort of work is pretty important. Flexibility of funds, either through grant options or things like that, would be really great. They tend to be very prescriptive and may not quite fit your need. So some flexibility within those funding sources from the feds would be helpful.
Good, thank you.
Thank you, Erica. And next up, we have Annette Carbino from North Country Health Consortium.
Sorry, I wasn't unmuting well. Thank you so much for inviting us to be here today. The North Country Health Consortium is a public health organization. So we come at this from a different vantage point than many of the people in the room. We serve the most northern regions of New Hampshire, all the way up to the tip of Colebrook. And we work through collaboration to bring all the other organizations and healthcare providers, et cetera, together to promote a healthier community. So mental health is a piece of that. Some of the programs that we have found successful out of our organization are the student assistant professionals that work within the school. We manage student assistant professionals in 8 SAUs. And these are folks that are able to work with youth, children, young adults, one-on-one, dealing a lot with mental health issues, also around substance use. We're also finding that our youth in the North Country are saying that they are restless. COVID has been hard. They're stressed. They are looking for outlets. One of the programs that we promote heavily is YLTA, which is Youth Leadership Through Adventure. I think Senator Shaheen, you're familiar with some of these programs. And what we've done is we promote that youth leadership for youth-driven activities. We have a huge virtual conference coming up. We put it on every year. It's youth-driven, a virtual arts program. So some of these activities around youth. And through these activities, they are connecting with adults and other folks where they can share their concerns. For us up here, we're also feeling that mental health is part of a whole person health. We're really trying to move upstream of some of these things. When you look at how the social determinants of health are affecting our families and our youth, homelessness and disconnection and lack of mental health and substance use to services. If my son has a problem with his mental health, I'm going to wait 8-10 weeks to get an appointment. Again, that's workforce development, not to be repetitive. So we're trying to supplement some of what's not working with things that youth can engage in, but they are still feeling very disconnected. We think training is very important for all the providers of services that wrap around families, evidence-based practices, really focusing on trauma-informed care, and ACEs, adverse childhood experiences. And again, where we come from in public health is really looking at prevention piece and moving upstream, not siloing mental health in one place and substance use in another and physical health in another. As administrative lead for the IDN Region 7 project over the last 5 years, we have seen a tremendous progress towards that. But there's always funding needed to keep that progress moving. The whole concept is that we are looking at children, youth, families as whole people. And if you're homeless, that's going to impact your mental health. If you can't eat, that's going to impact your mental health. If you can't get a dental appointment, if you've never been to the dentist, all of these pieces. So I guess from a public health position, we're really asking folks both across the state and nationally to look at this as a whole person issue. I know there's federal legislation around social determinants of health. It's been coming along, but really that's providing a safety net when people have a safe home, food to eat, and resources to reach out to. The last piece I'm going to just say is my favorite, and I will say it everywhere I go, is that we need stigma reduction. We need to make mental health something we can talk about, and whether that's a national program, a state program, but the more people that can get behind talking about mental health, so it's like talking about having a sore throat, we will then be able to connect people. People will be coming out and talking about, I have to go and get help. And without sharing, it's really, I think that we will have less impact on youth and young people who may be suicidal. Anyway, thank you so much for listening.
Thank you very much.
Good, thank you, Annette. Jody, representing the New Hampshire Community Mental Health Centers.
Good afternoon, Senator Shaheen, Sarah, and your staffers. I want to thank you so much for having us here today. And I'm so excited that my colleague Gina Steele is here from the Mental Health Center of Greater Manchester, because I think she and I are both probably going to echo some very similar things that we have seen over the course of this last year. It goes without saying that the pandemic has had a significant impact on the youth and families that we serve within the community mental health system here in New Hampshire. We know that increased sense of isolation, just that diffusion of roles within the homes where parents have had to wear multiple hats as employers and educators and caregivers, and children not having that sense of independence and individuation from their family system, and then really lacking those supports from their school systems that they once had. We know the importance of being in school, being able to connect with guidance counselors and social workers. And so I think our biggest concern is that second wave that's going to come in the fall as we see more children returning to full-time learning opportunities. We know here in New Hampshire, there is an order for children to return, and it's going to be for a few weeks before they go into summer break. And then we're going to have this extended period of time during the summer where those transitions in the fall, I think, will be a little bit more challenging. And many of my colleagues have already echoed, we had a workforce issue prior to the pandemic when it came to behavioral health. It's something that we certainly need to continue to focus on. But I also want to really highlight the silver linings that I think myself and my colleague at the Greater Mental Health Center of Manchester have been able to do, and that is how we've utilized telehealth in this very unique way that has completely reduced barriers to care that once existed. Within our catchment region, we're the eastern half of Rockingham County, but Deerfield is our furthest town in our community. For families who live in Deerfield, it could take up to 45 minutes at a minimum to get to one of our offices. When you incorporate a single parent who may be bringing 2 to 3 other children along for those appointments, it was a hardship to maintain consistent care. And so my hope is that we have some opportunities to continue the use of telehealth for both our bachelor's and our master's level staff once we get through this pandemic, because it really has reduced those barriers and made care accessible for everybody who wants to access it through our systems. But I think also using our initiatives around zero suicide, both of our organizations have staff trained. We've created this philosophical practice to reduce suicide by creating initiatives internally. And then many of us on this call have been working since early fall to talk about and address that ED boarding issue for children across our state. When I look at our trends that come through our emergency services staff and read the alerts that come through, we're not only seeing youth who are in crisis who are covered by our New Hampshire Medicaid products, but those who are covered by commercial plans. And there's this distinct difference in the care that's covered under those two plans. And we've been working with Senators Bradley and Sherman and Whitley to really work with the commercial payers on how can their coverage be more similar to that of our New Hampshire Medicaid products, because we know when we provide home and community-based care, it's at a lesser cost, and it's in that very organic way that families need that care in their homes, not in an emergency room. And if we can get our commercial payers to really reimburse the same way for those home and community-based supports, to allow our bachelor staff who are incredibly trained to provide behavioral strategies to really reduce those crises that are going on, and to provide that targeted case management to address those social determinants that Annette was speaking of. She's absolutely correct. If we can't meet those very basic needs on that hierarchy of scale that Maslow created for us, if you can't eat, if you can't feel like you have housing security, unfortunately, the last thing you want to attend to is your mental health and getting to the community mental health center for a mental health appointment. So I think if we can see a better balance between how our commercial payers are covering and reimbursing for those home and community-based services, and at those different professional levels that our New Hampshire Medicaid products offer, for me personally, I think that's one of the biggest steps forward we could take to continue the work that we're doing with Erica Ungarelli and her staff around the system of care, and the work that's really been detailed in Senate Bill 14.
Well, thanks very much. I actually am very optimistic that telehealth is going to continue to be here after the pandemic. I think it's one of the things that most people believe is a benefit that's come out of this pandemic, to see how effective it's been. And there are several bills that have been introduced. All of them, I think, have bipartisan support. So I'm really hopeful that that continues. And I appreciate the issues that you raise, and that Ken and others have raised around parity from insurance companies for coverage for mental health and the difference in plans. I think one of the challenges we have in New Hampshire is the reimbursement rates for Medicaid, that we need to see how we can increase those. So that's less on the federal side, but hopefully the insurance piece is something that we ought to address at all levels.
Good, thank you, Jody. Next up, we have the New Hampshire School Counselors Association, Maureen.
Thank you. A lot of what I was going to say has already been covered: the insurance, the inequity of families being able to access, whether it's accessing beds, whether it's accessing mental health, is something that we see. The use of telehealth, thank you for bringing that up. That has been a tremendous asset to families and to students where transportation is not a possibility. One of the things we were working on today is the minimum standards in education. The school counselor ratio in elementary school is 500 students to one counselor. For years, we have tried to get that lowered, but ultimately, New Hampshire local control, education, it's often seen as, nope, it's going to cost us money. We can't do it. We're pushing again for lower numbers again this year. So if anybody would like to sign on with us as we move that forward, please send me your information. I'd love to include you. Because ultimately working with students at a younger age and is going to help all throughout. Additionally, having more beds. We're hearing students coming in saying, there are 40 people ahead of me to get a bed in the hospital. What do I have to do to get help? That's scary to hear, because what are they thinking? They're not thinking, oh, somebody needs a bed more than me. They're saying, what do I need to do to get somebody to help me? And it's scary for parents to hear as well. Shout out to Greater Manchester Mental Health. They have a mobile crisis unit that I can't tell you how many times high schools in our region have utilized them to come in and help us work with students and families and promoting a wraparound service for the schools. Having that, everywhere. I think a lot of it comes down to, for counselors in schools, is the inequity. We have a funding problem in our schools, and that's just not in New Hampshire. Depending upon where you live, where you grow up, you have different access, and that's unfortunate for a lot of our students. The Office of Student Wellness in New Hampshire is a great asset to be able to work with youth mental health. I think for school counselors, we really see the need in lowering our case numbers and being able to provide wraparound services with all the organizations that you see here. But thank you for bringing this issue to the forefront.
Well, thanks very much. And one of the things that I think it's important to remind us as we think about the 350 million that's coming to schools, in the 100 and almost 23 billion that was part of the American Rescue Plan, there are significant sums set aside for trying to catch kids up for gaps in learning that have happened because of COVID. There are sums to help with summer school. We want to take away the stigma of calling it summer school, but to help with summer programs for kids, to help with kids who are at risk. And so all of those are pieces of funding that are available to schools. And one of the things that I hope we will all help do is to make sure schools know that those funds are available, know that they can use them for those purposes, and encourage them to actually do that. One of the challenges I found is that there's so much in this American Rescue Plan that just getting the basic information out so that people understand what's available and what they can make use of has been challenging. So we're trying to do that as to the best extent that we can. But if you have questions or need more information, please let us know, because we want to make sure that everybody knows what those dollars can be used for. We want to take full advantage of them.
Great, thank you, Senator. Just time check, we have about 20 minutes left, and we have several speakers to go. So next up is Chief Pearlie from the Jackson Police Department.
Chief.
Okay, thank you very much, Sarah. And thank you for having me. What I've been working on is a project that is under construction right now to improve police response and identification of mental health crises, particularly in the youth population, as well as the handoff that would accompany identifying a person at risk. Currently in police services, the spectrum of our conduct with mental health crises, particularly with young people, is there's either no crises and we take no action, or the crisis is full blown and the person's taken into protective custody and the IEA program, IEA process occurs. So most police officers are completely familiar with that process. So what I wanted to do was develop a protocol that would take care of and identify the gray area in between those two extremes, to try to identify people, young people in crisis, and connect them with a warm handoff to a downstream service. So with that, and in working in conjunction with Carroll County Coalition for Public Health, as well as NAMI, we've started developing a protocol for our law enforcement. The goals of the protocol are to increase the ability of police officers to identify youth in crisis, to increase the connectivity between those in crisis and the downstream services in mental health that they can utilize, and also to reduce the instances of use of force with persons in mental health crisis, by both reducing the instances by getting people the help they need, and also kind of not just sensitizing the police, but also making them more astute at identifying those subtle crisis areas that aren't full-blown protective custody. So through that, we're developing a training packet that'll help officers better understand and identify suicide risk and ideation in those situations that aren't quite as identifiable. And the example I always use is, you go to a conflict between a parent and a child, and you get there and it's a non-criminal conflict. You're asked to mediate and mitigate and you restore peace, but then it's to take it to that next level, and through the training and through the utilization of the Columbia Suicide Severity Rating Scale, identify what level of risk may or may not actually exist. So the first component of it is develop the training packet for officers to more effectively identify suicide risk in the field. The second is to condition them and to train them in the implementation of the Columbia Suicide Severity Rating Scale through their contacts. And that's the brief scale that they would use in the field. And then probably most importantly is to improve the connectivity between law enforcement officers and the mental health professionals for those warm handoffs, particularly in the regional areas, because we don't drive everybody to Concord. We have Northern Human Services in our area, and the Seacoast has Seacoast Mental Health. So it's really developing that regional connectivity between the agencies that need to and work and are going to work together. So that's the goal of it. Jackson Police Department is kind of the laboratory, the training ground, and we pretty much have 4 distinct phases involved in the better understanding of the mental health crisis, understanding and implementation of the CSSRS, and then our third phase is coming up in a couple of weeks to discuss how these are working well, and then the fourth phase will be the deployment of about a 4-hour training component to law enforcement area agencies in Carroll County to see if we can't get some traction and momentum in utilizing the CSSRS and connecting police to the mental health clinicians, which I think will have a synergistic benefit, because the more sensitized and the better conditioned the officers are to recognize mental health crisis, the more success they have with handing people off, and there's a good outcome rather than just a PC or they're responding to a tragedy. That's going to have a building effect, so they're going to want that, and it's going to happen more often. What I would like to see, or what I think the federal government can do to help through Senator Shaheen's office, is any kind of cost coverage for training. It'll be about a 4-hour block. That's what we're shooting for. Most law enforcement agencies are very dialed into 4-hour training blocks. So some cost coverage associated with that. Some legislative support for the implementation of the protocol, either through incentivizing the use of it or through withholding, certain beneficial funds should they not implement it, and also to increase through money support of the mental health clinicians for access during off hours. That's really when we work the most and they work the least. It's after 5, Saturday and Sunday, where people who are in mental health crisis know that they don't have resources readily available. That increases their anxiety. The police get involved. We don't have much as far as resources other than our own skill set and the IEA process. So that gap has to be filled with live bodies that can help downstream. Otherwise, it really just becomes the first 2 components of the program: heightened awareness by law enforcement and the use of the CSSRS, which is a benefit, but not a complete circle of service without that mental health clinician component. So that's what we're working on currently. Again, we've completed phase 2 and we're working towards phase 3. Implementation, if we don't hit any hurdles, could be, I'm going to say 2 months out. So that's the project that we're working on.
Well, thanks very much. Sarah's time check earlier was an admonition to me not to talk so much, so I will go on to the next person.
Busted. Next, we have the New Hampshire Psychological Association, Chris Smith.
Hi, everybody. Thanks for being here. I appreciate the opportunity to talk. NHPA was kind enough to let us speak for them. So Endurance Behavioral Health, just so if you don't know, we're intermediate level of care. We're PHP, IOP. So we get the kids that are stepping down from the hospital or try to keep them from having to go in. We're not a nonprofit company. We came from a nonprofit background and tried to create a company so that we would just be able to be flexible. And so that's the piece I would speak to, is the ability to, we would love to be able to do more, but we don't fit into the system. Like, we can't access funds. Like, a lot of these things we're already doing and helping with. Like, I can do more for kids in Mass than I can for New Hampshire. Like, and that's unfortunate to me. I wish it wasn't that way. But it is, because they're able to get us in their system, and we can't be in New Hampshire because our billing codes don't exist. So it's kind of just technicalities. I know people are working hard on it and trying to find creative ways. But if there was anything that, you know, from my perspective of providing the treatment, is that we have lots of things we want to do and can do. We just can't provide it for New Hampshire, for the kids in New Hampshire that have the least access to things, like, and you know, that's rough. You know, almost all the things that I was going to bring up, you know, have already been brought up. So I would kind of use the time to talk a little bit more about the things that we see in the struggle, like definitely telehealth. Being located in Seabrook, New Hampshire, we would get kids from Maine, New Hampshire, and Mass, but you know, kids from New Hampshire were driving all the way to plus 2 hours one way to get to the program. Now with telehealth, we can get kids all over the place, and we were able to make a program that has having the same outcomes as our in person. You know, but the next step is going to be getting the insurance companies to keep reimbursing at the same rate. I know for most folks, we talk about workforce stuff, like all the costs in this is payroll, regardless if it's physical or online, really. So that's a huge modality that can be used to do a lot of work and a lot of different program levels. So definitely can't speak to that enough. The the other part too, on a government level, is I personally fight with the insurance companies every day to try to get things approved for the kids. And just the ability that the insurance companies have so much power to dictate treatment. You know, we're seeing the kids for 30 hours a week with my team of 8 people that are all professionals. And I've got to fight with someone who's looking at the chart for a minute and just saying yes or no to what this kid gets. And part of that is a lot of the revolving door. That's the kids are being made to leave programs before they're ready because they don't want to pay for it. You know, that's private insurance that I deal with mostly for that piece. You know, and the reimbursement parity, all of that. You know, the more resources that get to the people doing the services, the more, you know, we have to be able to pay people competitive rates to do a very hard job. But that's the problem, you know, on its most kind of basic level. You know, and just being able to be creative. And then the other piece that, you know, I see a lot, and it used to be part of more, you know, is that people are being asked and they need to collaborate more, like getting folks to talk and interagency collaboration. But it's, you know, but you're pretty much doing that on your own time. You can't get it reimbursed. You can't, you know, everyone has to give, and you're already trying to do everything you can. You know, everything's stretched so thin, but these are solvable things. You know, it's just creating access and flexibility of funds and letting the people that know how to solve these problems be able to. Like, that would be, you know, without, I don't know the right way to say it, but, you know, you have to spend so much time and energy on trying to do things a certain way when you could do them better, at better quality, for less money, if you could just get to it. You know, really, and then all the other things folks have already brought up, so I don't want to take any more time.
Well, thanks. That's sort of the old HMO fight we had several decades ago.
Yeah.
On the reimbursement for collaboration.
Next up, Gina from Mental Health Center of Greater Manchester.
Thank you, Senator Shaheen, for having us. I would say, as the last few speakers have said, that everything has been said that I would have liked to have said, which is awesome, because it seems that we are all on the same page, that we're all fighting for staffing. I think some specifics that I could bring up so that I'm not redundant is that the community mental health center's ability to pay our staff oftentimes feels that it's at a greater disadvantage. And I could just cite the last 3 employees that we sought to hire, took positions at the VA, at the Department of Education, and at the state. And it was specifically due to pay. So as we've all said, this is a huge struggle for us. I think one area that we might be able to consider for higher reimbursement rates would be evidence-based practices. So the community mental health centers spend an exorbitant amount of time investing in training our staff in these practices, and then the practices take the clinicians more time to provide. So with enhanced rates for evidence-based practices, this might be a possible avenue for raising our salaries. it's hopeful. I would also echo that the acuity of what we're seeing, I can let you know that I'm in an admissions conference twice a week, and I'm hearing nothing but symptoms have exacerbated due to COVID. I just listened to 4 horrible cases in a row yesterday of domestic violence that were extremely violent, that children were bearing witness to. So certainly, if we don't have the staff, it's hard when your heart's breaking and you're hearing these children are exposed to these very violent situations. And I'm literally taking cases myself, which is not typical, because I just feel like there's something that has to give. And I know that everybody knows that suicide is a community-wide need, that we all need to participate in supporting one another. I think the Zero Suicide Academy was a fabulous opportunity for both the Mental Health Center and Seacoast. I just want to highlight that the Zero Suicide Academy is about training everybody. So if somebody in our billing department gets a call, that they are aware of how to handle these calls and that they can alert the clinicians. It's not just about the mental health clinicians, it's about all of us. So thank you, I appreciate the time.
Thank you very much.
Thank you, Gina. Next up, we have the New Hampshire Psychiatric Society.
Okay. Thank you, Senator Shaheen, for your concerns about youth and teen mental health. I'm Dr. John Henk, and I'm representing the New Hampshire Psychiatric Society. I'm a psychiatrist who has worked in New Hampshire for over 30 years at New Hampshire Hospital and Dartmouth Hitchcock Medical Center. Over the past few months, we are witnessing youth who are languishing in emergency departments for days, waiting to be admitted to a psychiatric hospital. I think we can all agree this situation is unacceptable. Recently, as Heather mentioned, New Hampshire Hospital opened a new temporary 10-bed adolescent unit to try to help address this crisis. What are we seeing among the youth and teens being admitted to New Hampshire Hospital? We are seeing adolescents who are suffering from a variety of COVID-related mental health problems. We are seeing increased depression, anxiety, self-injurious behaviors, and suicide ideation, all in the context of COVID-related stress, isolation from friends, disruption to families, and disruption to education. The adolescents seem alienated from their parents and society. What can the federal government be able to help with? Well, clearly we need better access to mental health services in both inpatient and outpatient settings. Regarding inpatient care, I would recommend restoration of bed capacity that has deteriorated over the years. Years ago, there were many hospitals willing and able to treat child and adolescent psychiatric patients. Today, only Hampstead Hospital remains, along with the temporary New Hampshire Hospital 10-bed unit. We simply need more child and adolescent beds so that our youth and teens no longer have to wait so many days to get the care that they need. And I would ask if large hospital systems could consider creating more bed capacity to treat our youth and teens. Regarding outpatient care, I would recommend increased funding to community mental health centers so youth can receive timely mental health care. We need to have a better continuum of care to try to treat youth and teens where they are at, including home-based care and school-based care models. We need more mobile crisis units, partial hospitalization programs, and psychiatric residential treatment facilities to better match the youth's unique needs with the right type and right setting of treatment. Thank you.
Good,
Thank you very much.
And lastly, we have the New Hampshire chapter of the American Pediatric Society.
Hi, and again, everybody has done such a great job. I think a big piece of things, I'm going to try and just do it specifically for the things that I'm recognizing. Workforce, very big. I'm Lisa DeBrigida, by the way, and I work in Manchester. One of the things about the incentivizing I've thought of, and I don't know how it works, but I know that there's providers get get incentivized to work in communities that don't have as many providers. And it seems to me that from a mental health standpoint, there should be some kind of an outreach that goes to incentivize paying back loans for what these people are doing and what they're trying to do for their school. That can really motivate somebody to kind of serve the population. So that was one of our thoughts about that. The second one is, I love the proposal that's currently being tossed around about paying the bachelor level people to do what they're qualified to do. And one of the things that happens, we have the distinct pleasure at Muskeg Health of having an integrated model of health, and that includes case managers who are addressing the social determinants of health. They do not get paid from insurance companies. They don't get paid. We can't figure out how to pay them. And we do grants all the time. And now our organization is actually looking at having to cut back. Well, this is the least thing that we need to do right now is cutting back on those case managers. They need to have the respect, and they need to, and it makes a huge difference in the mental health of these families, because they're not going to get to an appointment, and they're not thinking about the appointment if they can't eat and they don't have a place to live. Broadband access so that we can maintain the telehealth is fantastic and really great. There's no question that's a silver lining of what has happened this year, is all of us understanding how beneficial that is. And then I wanted to bring up sort of the prevention component. I love 988 for the suicide and things like that. And I love the fact that we're in the high schools, but one of the really big ones is really supporting the social emotional curriculum in early and middle schools too. The older kids are the ones who we worry about, and I understand that. I don't know about the rest of you, but nobody could pay me enough to go back to middle school, partially because of all the stressors that happened at that time. And I think we forget that population. And I think that the LGBTQ, I think that our cultural differences in Manchester and Nashville and the sort of southern tier are just in our faces. And these kids are dealing with so much. Social media is in their brains, and it's been a real challenge. I'm not sure how to address the social media, but I certainly think that by addressing some of the programs that are in the school systems, it can help. And the earlier we do it, the better. Teaching meditation in first grade and kindergarten is a wonderful idea. And then I'm going to go to parent support. I think that's another huge one. A lot of these parents didn't get that kind of training at the beginning. They don't know how to offer it to their children, so that becomes a big piece as well. But thank you to everybody else and all the work that you're doing.
Great. Thank you. We'll turn back over to you, Senator, for some closing remarks.
Well, thank you, everyone. I know we could have spent much more time, and I wish we had more for me to hear from you about what you're seeing. But I took some really good notes, and I know that everybody else on the call did as well. As we're thinking about sort of the whole person challenges, and a number of you brought up the fact that you can't worry about your mental health if you don't have a bed to sleep in, if you don't have food to eat, all the other basic human needs. One of the things that I think the American Rescue Plan has done is to provide additional help for people in this time, to address nutrition and meals, to address housing and homelessness, mortgage help for families, to address substance misuse, to provide additional coverage for healthcare. So if you haven't seen some of those pieces, we can share those with you, because there are additional items in the American Rescue Plan that are going to be of real help to the people that you're serving. And we want to make sure that you know what's in there. So thank you all again so much. We are going to keep working on this. We're looking at trying to do a series of events around mental health that can highlight some of the issues that you raise. And we're going to keep working in Washington to address the workforce issues and the funding of our mental health, to make sure that we continue to reimburse telehealth at the level that we're reimbursing other patient visits. So, as you know, this is an ongoing challenge, and we've all got to work together to address it. And I very much appreciate everything that each of you is doing in your particular area of expertise to do that. So thank you very much. We will stay in touch, and please let us know if you see things that we should be thinking about in Washington, or if you have questions. Thanks so much.
Thank you.
Thank you.